Hi, so everyone, let us see this recent advances questions. So this type of questions which is coming in the recent exam paper, I will tell you how to write this question in the exam. Of course, this is purely for the theory exam basis that if a question comes on, for example, artificial intelligence in ophthalmology, how can you frame the answer? Either it can come as a long or a short. In long, you have to write in detail. I will write in detail. But if it's in a short, you can just write the main highlight features. Okay. So let us start this artificial intelligence. So the first thing you should write what is the definition of this artificial intelligence. So it is a combination of some algorithms which are created in such a way that they are aiming at creation of a device or a machine with has same or even more ability than humans. That's the first line you can write down if the question comes on AI in ophthalmology. Then what we can write down over here is that there are various systems developed by various people over the years when AI has been established. So, for example, there are four types of systems which are there in AI, and it's always good to write down. Even if you don't write, doesn't matter. The name of the people who told about the system for the first time. So there were two scientists by the name of Stuart Russell and Peter Norvig. So you can just write down Norvig or Russell. They gave four type of systems. I'm telling ABCD in my answer like this. The first system, they said that the AI should think like humans. Second, they say it should system that should act like humans. Third one, the system that think rationally. I'll give examples of these. And the fourth one, which can act rationally. The first example of think like humans is what is nothing but in the long note you can write down it's like a decision making or a problem solving. Any problem given to any system, it is solving like thinking or making decision like human beings. The second one, act like humans, you should know that is nothing but robots. The third one, thinking rationally, is a system which is created, which is given a specific name known as expert systems. In long note, you can give an example of that machine is perceiving the reason and it is taking action based on that reason. That you can write down extra if it is a long note. And act rationally means it is acting like a intelligent agent. That was given by Russell and Norvig. But this is a general thing. Now comes in ophthalmology. In ophthalmology, you can next write down that out of these four, mostly used are A1s and C1s. A is in my think like humans and C is think rationally. For example, A is mostly developed in ophthalmology, that is thinking like humans means, for example, screening of some fundus images or optic disc images, that the machine is provided with the load of images and the machine is thinking like humans and saying, I'll give examples that yes it is a condition or no it is not that condition, like a diabetic retinopathy, like a glaucoma. Now C usually not in India, but still you can write down. It is like a eye early detection. Now what is that meaning? Like for example, that the machine can recommend the patient to a nearby center or nearby hospital, or it can schedule the appointment as well. The machine can think rationally and schedule appointment for the person, or based on the basic symptoms which the person is inputting into the system, the machine can recommend the patient to the nearby eye clinic. But generally in India it is not like that. It is just we can walk in. But generally in outside conditions, this Norway and Russell are not in India ना, बाहर के देश के हैं, so they are outside people, so they think according to their system. But of course in the exam you can write down that in opthal, the thinking like humans and acting like thinking like humans and thinking rationally are the two ones which is mostly developed in ophthalmology. Now the next thing after the definition and the systems, you can jump on to some algorithms. Now in some details I will tell you that there are various algorithms. Like for example, AI is a big uh, for example, if I just draw this, or it's good for you if you can draw such boxes or circle in the exam. So AI is a broad category artificial intelligence which includes something known as machine learning. Now machine learning is an algorithm which is machine is learning from experience. Algorithm which machine is learning from experience. What experience? The data. Experience means what? A huge amount of data is given to the machine, and by experience, by looking at the data for a long data, the machine can decide on that condition. Now this machine learning is including a thing known as a subset which is known as a deep learning. Now deep learning is again a algorithm which is implementing a subset known as deep neuronal network. So that is DNN. So I will write over here, deep learning is an algorithm which implements deep neuronal network. And this DNN ultimately is including another subset, which is the one which is used in ophthalmology most commonly to create algorithms, which is known as CNN. CNN is convolutional neuronal network. Now it is what? It is a supervised deep learning algorithm which deals with the images. So we'll write over here about CNN because that is the mostly used in ophthalmology. So it is like a algorithm which is a supervised. Humans are supervising, of course. It's a supervised deep learning algorithm which is dealing with images. Like for example, images like from fundus photo, from optic disc, from OCTA, from OCT, those images, fundus images, OCT images, or optic disc photography, fundus photography, or even OCTA angiography, that is mostly used in ophthalmology. Now, in this CNN, In the CNN algorithm, there are some tasks. The next you can write down after this that what are the tasks. The tasks are majorly three tasks. One is image classification. Second is image segmentation. And third is what is known as a regression. Now in the long note, of course, you have to write one or extra points regarding this. What is this image classification and all? Now classification is a simple thing. For example, I'll give you one example which I'm just giving, like a fundus image is being provided to the machine. Okay, and that fundus is given, for example, for a diabetic retinopathy predictor, or even it can be glaucoma predictor. Optic this image can be given, and there are two responses. One is yes, one is no. Looking at all the number of images which has been provided to the AI tool, the DR predictor can say it's a yes or no, yes retinopathy or no. Now if it is a yes, then it can also can tell about the staging or the classification of diabetic retinopathy based on the ETDRS classification. Now what is the advantage? It is with probability score, that how much is by chance and how much it is actual. Second example of image segmentation is you identify, the meaning of this is you identify some anatomical tissue or some anatomical lesion. That is the meaning of image segmentation. Now for example, um, retina vessel segmentation, like in diabetic retinopathy itself, or maybe choroidal vessel segmentation in choroidal new vessels. That machine can do segmentation of the images. And third, regression has the output in a real number. Now this is quantitative analysis can be there. For example, visual acuity. Visual acuity pre and post maybe treatment like anti-VEGF injections. Pre and post some anti-VEGF injection of diabetic retinopathy in age-related macular degeneration, the wet type. It can also tell about the CME, cystoid macular edema fluid, the quantification of the value of the fluid. Also, it can tell about the anterior chamber angle parameters in glaucoma patients. So next, it is good to write the three CNN. These are all the three are CNN tasks: classification, segmentation, and regression. Now, first, just to overview, we have dealt with that what is the definition of the AI, and second, what is the system? It is thinking like humans and rationally. That is mostly used in ophthalmology. In ophthalmology, A and C are mostly used. I told you, and one more example that you can give. Then, what are the algorithms in general? What is used in ophthalmology? That is CNN, and CNN can be mostly of three tasks. And then at the end, of course, you have to write down what are the applications in ocular diseases. Applications of AI in ocular diseases. So if you say point by point all these things, of course the examiner who is checking knows that you have read about this or you have the knowledge of this. Now first example, for example, diabetic retinopathy, I'll tell you some. Then some points you can write down about ARMD. Then in glaucoma. Now this is also like in the telemedicine also you can write like this, because telemedicine nothing but artificial intelligence only. Even in ROP it is coming up. Keratoconus. And in cataract as well. How? For long node you have to write down, of course, some more points regarding this, some quick points. Like in diabetic retinopathy, the advantage will be of detection. So many people are diabetics. Many people are diabetic retinopathy. The detection of diabetic retinopathy or detection of diabetic macular edema. First thing. Then classify. The AI can classify the diabetic retinopathy. Then response to anti-VEGF injection. Then segmentation of the retina vessels, like I told you already. Now here I will tell you the algorithm which is used actually, which has been accepted by FDA or even Singapore. Like for example, it's good to write down. For example, in diabetic retinopathy, IDXDR, that has been approved by Food and Drug Administration of USA, or EY Iris, but I not EY RIS, Selena. That's the name of the AI which has been approved by Singapore, and CE. CE means that is approved by European countries. So that is for diabetic retinopathy. Now, in ARMD, uh, first ARMD, many old people have. So think rationally. One, they can screen the patient, and they can have a algorithm to refer or not. So that is also beneficial algorithm to refer or not to refer, mostly not in India but in Western population. Next, of course, staging. Now, staging is done according to IRIDS, using IRIDS only. So that's the data has been provided to the machine, and staging is done according to the fundus photographs using IRIDS. Quantification, visual acuity, post anti-VEGF. All right, and then yeah, pre and post visual acuity, post anti-VEGF in wet AMD. Next, in glaucoma, disc photos are being provided, and they can provide the OCT images as well, OCT RNFL images. On this basis, now there is a drawback over here that IOP, of course, cannot be evaluated, but at least looking at the disc photos and OCT, they can screen whether the patient is having glaucoma or not. So generally, only for screening or detection, early detection, AI can be useful. And of course, management per se, progression also can be noted by the machine, and then they can, for example, they screen, then they can refer the patient to the nearby glaucoma specialist. Like in ROP, it is coming screening from the fundus images. Now, ROP is very difficult in child to have a screening, so screening from the images, fundus images, can help in the machine can tell whether the child is wanting, which stage of the ROP is there, and which management is required or not. Now, what is coming up is now in keratoconus. Now, keratoconus is a screening is done by K values. Okay, and then topography pentagram images are also being provided nowadays in some machines which are coming up. Not recently, they have not approved some, so that's why I'm not telling. They are in pipeline. So topography imaging analysis can be done by the AI machine, and intracorneal ring segments, if it is given, if it is done, the prognosis, and then according to the visual acuity outcomes or the decrease in the K values, that can be also uh, seen as a progression, or it is going well in keratoconus patients or not. That ICRS, intracorneal ring segments, I hope you know. Now, how in cataract? Now, cataract, it can be useful in IOL formulas, like selection of which IOL formula. development or the selection of which IL formula or calculation of the IL formula. That is what it can be helpful in cataract. So this you can write down this if there's a long term. And lastly, of course, it is always good to write down some drawbacks as well. Now, one drawback is, of course, it is if there is an error. If there is an error will be on a mass scale, because if there is a machine and if some problem is happening with the machine and so many images are being given to the machine, that all the images will be having errors. So there will be a mass scale error if there is a error in the AI tool. Privacy of the data is a big concern. Third, cost. Of course, development of the tool or the app is also has to be taken care. Now there is a last thing which I have read known as a nirvana fallacy. Now that is also a drawback. Now what is a nirvana fallacy? Is a comparing of an actual thing to an unrealistic thing or an idealist scenario of what has been seen before. Means, for example, now we know a diabetic patient retinopathy looks like this. We have fed this to the machine. Now this is the unrealistic or idealist scenario. What has been, which has been fed already to the machine. Now humans are evolving things. If something happens extra in a diabetic patient, that thing machine won't be able to get. So that is the comparison, comparing a actual thing. Actual means today's patient with a idealistic or a unrealistic scenario. That is a nirvana fallacy, and that is always in every artificial intelligence tool. So that is what we can write down in the recent advances. The question comes on AI in ophthalmology. All right.